most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So the question is, can not my, but yours, can your herniated bulging disc or sciatica heal? Big question. And we're going to answer it today. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free. We upload every day. Also, yes, sir, Bob, you're going to want to join us on our website, bobandbrad.com. because we're giving away a huge giveaway this week.
Yeah, it's big.
Go to the giveaway section or go to Bob and Brad on Facebook. It'll be pinned at the top of the page there. If you want a shorter version of our program, join us on Twitter or Instagram.
There you go.
So what are we giving away, Brad? I got to show this here.
Yeah, this is a very nice, comprehensive package.
We're giving away a massage lounge.
There you go.
An entire lounge.
Right.
We did this for some nurses at a nursing home.
Right.
And now we're going to do it for you. So you get, well, Brad, what do we got here? A foot massager.
Right.
We got like an upper back massager. You can actually use it on the low back too.
Low neck as well.
A full back chair massager. It kind of fits in your chair.
Right. You bet.
And then we got 3 hand massagers, handheld massagers.
Right. Which work the whole body wherever you can reach.
So you could set up a lounge in your house and you're going to be the most popular person in your neighborhood, or you can give away some of these.
There you go.
Gifts with Christmas
It's that
coming
time
up
of
here,
year. Okay, Bob,
right.
I've been, this is a really good subject that I'm anxious to get into because we get a lot of questions. How long does it take for my disc to heal? Can it heal?
Right.
And there's a lot of, good information that I think that we're going to, share.
I got contacted by a young man that was really distraught. I mean, he goes, am I shot for the rest of my life? I got a herniated disc, and so I let him know that yes, it can heal, and that yes, it is most likely to heal. The majority do. The body has an enormous capacity to heal if you allow it. So you're going to want to avoid the things that make it worse, which we have in other videos like bending forward and stuff like that. But let's show what happens when you do have a herniated disc or a bulging disc, Brad.
Yeah. So this is our famous coffee cup vertebra model.
Yeah, Brad invented this.
Yeah, well, I got the coffee cups from an anatomy place, and then I've got one of these at a store where you walk out and it happens to squish, and it really does a nice job of duplicating a herniated or bulging disc. So this represents a disc. They're not round, but they're like that.
And I'd be in this position if my back was like this right now.
So this is L5 and this is L4, your bottom 2 vertebrae and your low back. The disc, and this is where most herniated discs happen. And so if you bend forward like that, this is the mechanics that happens. Now, what happens if you have a weak disc from whatever the problem may be?
From repetitive use.
Usually that's it.
You can do that. Look at that. Watch it bulge right out or herniate right out. And then there's a nerve right back there that it could, bulge up against and cause pain down your leg.
Exactly. And that's the sciatica. So if we can do some exercises that allow this to go back into where it's supposed to go, and then keep it there and allow scar tissue to heal over that bulge area so it doesn't come out anymore, that's the goal.
Right. And let's just say this, Brad, that, on a normal healthy disc, you can bend forward like this.
Oh, right. It's not a big...
That's just going to happen. But if you do it repetitively over time and with weight, then you're putting stress on that disc.
In other words, you're lifting up
you're putting
hay bales or whatever work you do.
With your back rounded out like this, not in a good spinal mechanics. Yeah, right. So what happens? How can it heal, Brad? I thought maybe we'd show this, Brad.
Oh, sure.
So, this is the part that's bulging out. Well, one thing, this disc material can sometimes get reabsorbed right into the body, right into the other disc.
Right.
The other thing, the disc material might dehydrate and it no longer causes problems. The water comes out of it.
Sure.
Desiccates. What is that? What are they? No, that's when it deteriorates. But the water goes out of it. So dehydrates. All right. Also, in response to inflammation, the body creates little microphages, which I like to call like little Pac-Man cells.
Sure.
Are we dating ourselves when we say that? Do people know what a Pac-Man cell is?
If you're over 50, you do.
Yeah, that little game where the thing would go around. Oh, even Liz knows
and
that.
she's only
So,
29 or something.
we don't say her
Maybe
age.
21.
So, all right. So anyway, that little macrophages can come in there and they'll eat the disc material. Isn't the body a wonderful thing,
Right.
Brad?
Well, on my X-rays, I don't even have a disc between L4 and L5, and I know that's exactly what happened because it just didn't disappear.
Right.
It took time. This doesn't happen in a couple weeks.
Right.
This is something that may take months.
It may, but to be honest with you, I'll talk about that in just a minute. But the
Okay.
last thing you can do is if you do McKenzie exercises, McKenzi, type in Bob and Brad McKenzie, and
Mhm.
we're going to show you all sorts of exercises that you can do for the disc problem.
Right. And Mackenzie's a therapist who developed a worldwide system that I think for over 50 years it's been going.
Yeah.
How to treat sciatica to get that disc to centralize and heal again.
Yeah, especially if you're a younger person and you have 70% of your disc left, they find out that technique is very helpful.
Right.
If you have less than 70% of your disc, it becomes a little questionable whether that's going to help.
So people are going to ask, how do you know if you have 70%?
I don't know. I guess
Well,
you
you
have
do
to-
the exercises. If it
Right.
works, well, then you did.
That's right. So how long? The symptoms often improve within 6 to 8 weeks if you don't re-injure.
Mhm.
But 6 to 8 weeks can be a long time, especially if you're having, really severe pain. And, if you're having nerve damage, so like let's say you're getting weakness in your foot or your
Oh.
toes or ankle, then you may have to have surgery.
Right.
I mean, you can't allow that nerve damage to continue and you're going to have permanent weakness.
Right. And then they'll go in and hopefully all they need to do is open up the foramen, or they'll do a discectomy where they don't take the whole disc out. I think they just
Right.
take the part out that's interfering with the nerve.
Right. Also, if you're having trouble with your bowel or bladder, or if you have numbness and tingling, kind of what we call saddle anesthesia,
Mhm.
the place where all the parts where a saddle would hit when you're
Sitting on a
when you're sitting on a
horse.
horse, then it's time that you need to go in. But otherwise, you should do your best to hold off. I know it's a drag. It's some of the worst pain you probably are going to have in your life. But if
But-
you can get through,
Right.
without surgery, you're going to be better off.
And if you can get to a McKenzie certified therapist, it's going to make a world of difference because that's what they specialize in. We do have a video.
That shows you how to look up a McKenzie therapist.
Right. And again,
So,
I believe they're in 40 countries now worldwide. In the United States,
definitely the high 30s, I know. It
right,
was,
right. So there's a lot of clinics that will have these therapists available.
all right. Well, good luck with it. And keep your spirits up.
We bet.
We hope it heals quickly for you. Thanks.